Hello, my name is Dr. Tony Dorso, and I'm the supervising psychologist and section chief at the Audrey Hepburn Children's House at Hackensack University Medical Center. The Children's House is one of 4 legislatively mandated regional diagnostic and treatment centers who deal with children who are abused and neglected. In this module, we are going to talk about behavioral indicators of sexual abuse, physical abuse and neglect, and emotional harm. But before we start the module and the particular indicators of abuse, it is important to think about the mandated reporter. As you become aware, mandated reporting is the responsibility of every citizen in New Jersey. It is important to understand that a mandated report falls under the notion of reasonable suspicion. That is, that we see behaviors in children, or they tell us things that would suggest that adverse things are happening to them by older children, adolescents, or adults. It is also important to realize that mandated reports do not require proof of abuse, but rather suspicion of abuse. In this way, the proof of whether a child was harmed or not falls to professionals who are specially trained in interviewing, diagnosing, and treating child abuse victims. Let us now talk about child sexual abuse. When we think about behavioral indicators in child sexual abuse, we generally think about 3 sets of behaviors. The first set of behaviors are general indicators of distress that children demonstrate when harm is occurring. Those general indicators are things like worry and anxiety, startle responses, fearful responses, or responses that suggest that the child is not taking care of themselves, such as eating or bathing. In addition, they may be fearful or worrisome in their presentation in your daycare center, school, or agency. The second type of abuse indicators fall to the area of traumatic responses. We know that in post-traumatic responses, we have to have an event that triggers the accompanying behaviors. For some children, they become very fearful and worrisome. For some children, they talk about adverse events. For other children, as you begin to talk to them about things in their life, they're avoidant or seem to be far away from the discussion that's occurring. In psychological terms, we talk about that as numbness or dissociation. As a daycare provider or teacher, you would not be expected to diagnose or understand these symptoms, but rather be knowledgeable about their presence in children so that you can create a mandated report. In that mandated report, it would be important for you to put as many behavioral indicators as well as specific sentences or ideas or thoughts or language that the child uses that to you indicate harm is occurring. The third set of symptoms, and the closest we have to a sense of prediction of child abuse, are repetitive sexual behaviors in children and adolescents. While this neither proves nor disproves abuse, young children who will not be responsive to redirection, children who touch other children, who masturbate, who take poor care of themselves, are concerned or afraid about toileting or showering, may be victims of child sexual abuse. When a child engages another child in sexual activity, that is another strong indicator that the threshold for a mandated report is to occur. Again, it is important as best you can to identify the language and behaviors that you think are causing the child distress and that may be indicative of abuse in the area of sexual abuse.
Welcome. My name is Dr. Gladybel Medina, and I am the Medical Director of the Dorothy B. Hirsch Regional Diagnostic and Treatment Center located at St. Peter's University Hospital in New Brunswick, New Jersey. I am part of a multidisciplinary team of professionals responsible for the evaluation, diagnosis, and treatment of children and families when there is a concern of abuse and neglect. In this segment, we will be focusing on the physical signs, the physical presenting signs of child abuse. As mandated reporters, we all have an obligation to become familiar with the presenting signs of potential inflicted trauma so that there is a timely response and intervention by protective agencies to ensure the safety of the child. When we talk about physical abuse, the most common finding that you will come across as you're interacting with children would be skin injuries. Now, skin injuries most often are in the form of bruises, but you can also have abrasions, which are scrapes, lacerations, which are open wounds, and even burns. As we all know, children are very active, and ambulatory children, or children that are able to move from one place to the other because of cruising, walking, running, jumping, etc., they will sustain injuries as a result of routine play activity. However, when we're talking of in that context, the injuries are usually focused and located over bony prominences such as the forehead, the nasal bridge, the chin, the shoulders, the knees, the elbows, and especially on the chins of the lower extremities or legs. These are often nonspecific, round, patchy, and then they don't have really a shape to them. So when then should you be concerned about the appearance of an injury that does not fit that routine criteria? In that context, I'm going to give you 6 specific signs and some easy words to remember that you, if you want, you can write down so that you know when to prompt you to call the hotline. For example, number 1, 4 months. Developmentally, children and infants younger than 4 months don't really move around. So at 4 months of age or younger, any child, an unexplained bruise on any child anywhere on the body should really prompt you to call the hotline because of suspicions for possible inflicted trauma. Number 2, the mnemonic 10-4, for example, number 10, capital TEN-4. That stands, just for an easy way to memorize, that children under 4 years of age with bruises located on the T, torso, for example, the chest, abdomen, and back, E, ears, and N for neck region, that when they are unexplained, that is also suspicious for abuse. Number 3, shapes. Keep in mind that when children are forcefully hit with objects, oftentimes there might be a mark left by the object itself on the skin of the child. You might come across multiple linear markings all over the body, looped markings, and those are usually suggestive of impacts with objects such as cords, extension cords, cables, belt marks, rulers when they're rectangular in shape. You might come across handprints or shoe prints, or the perfect marking of other common household objects that are often used for corporal discipline. That should alert you to prompt you to call the hotline. Number 4, think of too many marks on the body of the child, extensive markings or bruises all over the body of the child, unexplained, should also raise suspicions for abuse. Number 5, bite marks, unexplained, on any child, should trigger that phone call as well. And number 6, burns. Burns most often are hot liquid burns, but they can also come as, for example, cigarette burns, lighter burns, or contact with hot objects. Parents or caregivers should readily be able to explain a mark such as those on a child's body, and when there is no explanation and the child is unable to tell you what happened, that should trigger all of us to make that phone call to the hotline. Another area of concern, of course, is neglect. And neglect is really failure of a caretaker to meet the needs of the child. What are those needs? Food, adequate nutrition, shelter, housing, clothing, especially for the weather, winter, summer, how are they dressed? The medical needs of a child, are they compliant with the treatment? Are the kids' needs being met medically? And then of course education. They should be attending school, and there are many factors in the home, sometimes with household dysfunction, that will prevent caretakers from really meeting the needs of the child at that level. Supervision is also another important one. Children that are experiencing neglect or emotional neglect in their home might be withdrawn, might come home or to your place of work hungry. They might be asking for food, they might be dirty, they might be socially withdrawn. And all of that, if there's really no explanation as to why that's happening, that should prompt a phone call to the agency so that we can look into it and meet the needs of the child. Keep in mind that as mandate reporters, it is not our obligation to confirm or investigate that abuse has actually occurred, but rather to suspect abuse and immediately reporting. Failure to act on our part on behalf of the child might leave that child in an unsafe environment at risk for repeated assaults and possibly life-threatening events. You can make a difference, and it really starts one child at a time. Thank you.
It is important now to talk about indicators of what is commonly referred to as emotional or psychological maltreatment. This by far is the hardest form of maltreatment to understand and prove that a child is abused. These indicators include both the general indicators of distress that we've discussed previously and also specific responses. So if we think about a child who's emotionally or psychologically harmed, those behaviors could include things like belittling, intimidating, name-calling, areas of picking particular difficulties that the child has and making fun of them, or simply mechanisms that will allow a parent to control a child. When kids are experiencing psychological or emotional harm, they often mimic the behaviors of the perpetrator. So when we have parents who are belittling, ignoring, isolating, or harming children emotionally, the child may do the same thing to their peers. In a different way, the children also may be responsive to the emotional harm or psychological harm that accrues by withdrawing. So for kids who do not interact, find it difficult to form relationships, are wearisome of people around them, or seem to be suspicious, those would be general indicators as well of the potential for emotional and psychological harm. As with the previous parts of the module, there will always be behaviors that are less specific and more specific to the particular type of harm. In this case, psychological harm is likely to translate into factors where the child would mimic the behaviors of the perpetrator rather than pure isolation and withdrawal. For a more complete list of the indicators for sexual abuse, physical abuse and neglect, and emotional or psychological maltreatment, please refer to the materials provided.